Riya.
Imagine this. You walk into a hospital room filled to the brim with patients. Some are coughing, some are in pain, while others are barely hanging on. And then someone tells you you can only treat those who can pay. Could you do it? Could you really walk past a sick child because her family has no health insurance? That impossible choice is reality for millions of people every single day. In 2024, about 8.2% of Americans, roughly 27 million people, had no health insurance. No health insurance means no regular doctor, no checkups, and sometimes no chance. When I first learned this, I was like, wait, this is America, the land of opportunity, innovation, and apparently $50 band-aids. But then it hit me. This wasn't just about money. It's about morality. It's about whether healthcare is a right or a privilege reserved only for the wealthy. Last summer, I participated in advanced health and public internship at Georgetown University, where we learned about developing nations, specifically Nigeria. We learned about 4 prevalent diseases: malaria, typhoid fever, respiratory illnesses, as well as nutritional anemia. Diseases that sound small, but take thousands of lives every year. What broke me was this. During my internship, I was able to diagnose a little girl, about 5 years old, who had 2 of these diseases, malaria and typhoid fever, and was suffering tremendously. Her family had to fight tooth and nail for it to even get considered for treatment. These are diseases that could be cured easily in the US, but only if you have insurance. One country cures the disease with a pill, while another loses lives because medicine costs a paycheck. Why such a difference? Because modern medicine is expensive. MRI machines, surgeries, advanced drugs, trained professionals all cost money. So, who gets treated? Well, the answer is blunt. Those who can afford to get treated. Wealth becomes the gatekeeper of health. Yes, we have Medicare for seniors and Medicaid for some low-income families. Here's the problem. Millions of working adults fall right into the middle. Too poor for private insurance and not poor enough for government help. These are families juggling 2 jobs, still choosing between paying rent or seeing a doctor. That shouldn't be a choice in the richest country in the world. Meanwhile, across the ocean, England's National Health Service, or NHS, provides free healthcare to everyone. How? Because it's tax-funded, not profit-driven. They don't have hundreds of insurance companies, layers of copays, or mountains of paperwork. They have one system with one goal: to keep people healthy. It's not perfect. I mean, no system is. But at least no one goes bankrupt from a hospital bill. Imagine that. A world where your health doesn't depend on your wallet. So, why does this matter? Because in too many countries, including our own, healthcare is still a privilege. It decides who gets treatment, who suffers from something preventable, and sometimes who lives and who dies. And to me, that is just the greatest injustice of all. But I'm not here to point out the problem. I'm here because we can fix this. The future of healthcare, our future, is in the hands of the next generation. Our students, policymakers, doctors, nurses, leaders, as well as everyday people who believe compassion isn't optional. That means standing up when policies are being debated. That means voting for leaders who care about accessible healthcare. That means volunteering at clinics, donating blood, and supporting local healthcare initiatives. That means checking in on neighbors who may be suffering. We can build systems based on compassion, responsibility, and trust. We can choose a future where healthcare isn't a privilege, isn't even just a right, but a shared promise. A promise we defend in our conversations. A promise we refuse to ignore when others are suffering. A promise we support with our time, voices, and actions. So the big question isn't, can we afford to make healthcare universal? It's, can we afford not to? Because at the end of the day, health is not a privilege. It's not a luxury. It's a promise. A promise that every human life matters, no matter their paycheck, their passport, or their insurance card. And that promise is worth keeping. Thank you.